Hello there, welcome back to Dr. Z's Health Education videos. I'm Dr. Zaidi, and hopefully you had a chance to watch the intro to the eye video. And now I'm going to be speaking to you about a specific eye condition called age-related macular degeneration, or AMD. AMD is one of the most common causes of vision loss in the United States and around the world. So this is a condition that I see very common in my clinic, and I want to take a few minutes here to explain what is AMD. We'll start with the words themselves. Age-related, which tells us that this is a condition that's common in older folks. Macular, which refers to a specific part of the eye called the macula, which is a piece of the retina. And then degeneration, which means breakdown. So we have an age-related condition that results in breakdown or degeneration of the macula, which is a part of the eye. Just to review briefly, the macula is the part of the eye that's back here. So let me see if I can highlight the macula. So again, front of the eye here, we have the cornea, we have the lens, and then the back of the eye is the retina, and then this very specialized, see if I can get my pen to work here, this very specialized portion here is called the macula. My wife is going to say that my handwriting is horrible, but again, I'm a doctor, so not known for my outstanding handwriting. Sorry about that. So if I were to take the macula and kind of focus down on this issue and magnify it and look at it sideways, I would say that the macula actually has several layers to it, and we'll call this first layer the macula itself. And these are the cells that are responsible for our vision. And then that layer sits on top of another layer called the retinal pigment epithelium. For the purpose of this video, we'll just call this the pigment layer. The pigment layer can be thought of as the soil for the grass, so to speak, that is or the garden that is the macula. So the pigment layer, just like soil, provides nourishment and support to the macular layer, to the macular cells. Without this pigment layer, you cannot have a healthy macula. Just like without good soil, you can't have healthy plants and flowers. Now there's one more layer that we should point out, and that is a blood vessel layer. Officially, this layer is called the choroid, but for the purposes of our video, we'll call this the blood vessel layer. And this area is full of blood vessels that also supply oxygen and nutrients to the eye. So I should also point out that light, just like in this diagram, light is going to be entering from the front and landing onto the macula. In our diagram here, light is entering from the outside world, landing onto the retina like so. So, what happens in macular degeneration? Now I'm going to focus, there are two forms of macular degeneration, dry and wet. I'm going to talk here in this video about wet macular degeneration, so wet AMD. So what's happening in wet macular degeneration? This is the part, this is the type of macular degeneration that is the most dreaded form. It is the form that generally causes the most severe form of vision loss, often causing abrupt loss or blurriness of the central vision. And the way that works is damage over time to this pigment layer. So if I were to basically draw holes in this pigment layer, let me see if I can do a better job of that. Perhaps I can do this. So if we see here all of a sudden holes forming in this pigment layer, sort of defects, so to speak. So here we have a hole in the pigment layer, here we have another hole in this pigment layer. So now what this allows is these blood vessels that belong down here to sprout up just like weeds growing in your grass and start to bleed. So then you have, I'll draw in red here, some bleeding here and some bleeding here. So all of a sudden you've got a hole in this barrier which allows blood vessels to grow up into the retina, into the macula, and bleed. And as you might imagine, when light is entering into the eye, if it's hitting blood and damaged retina, you're not going to see a clear image. So if in this diagram over here, if I were to draw some blood in the macula, you can imagine that light from the outside world hitting a retina that has blood in it isn't going to do too well. So unfortunately, patients with wet macular degeneration have blood vessels growing into the retina, they bleed, and unfortunately the blood sometimes will clear up and leave a scar. And that scar results in permanent damage to the retina and results in a permanent blind spot or a gray or black spot in the patient's central vision. Because the macula is responsible for the central vision. So in other words, if a patient uses that eye to look directly at some words on a screen, they will see blurriness. But off to the side, where the retina is still healthy, the patient will still have normal vision. So patients with macular degeneration or wet macular degeneration will tell me that their central vision is blurry, but they still have good peripheral vision. And I wanted to illustrate that to you with a picture. Here's a picture of my beautiful niece. And if you were a patient with wet AMD and you're using the one eye that you have that has wet AMD with bleeding and scar tissue formation in the center of the retina, what you might notice is that the center of this lovely baby's face starts to get blurry. And depending on the size of that hemorrhage and the size of that blood clot, you might begin to get blurriness and loss of the center of this baby's face. So here we see a situation in which the patient is not completely blind, but does have loss of a major central portion of the vision. And if the blood vessels are allowed to proliferate and grow, often a large scar will form, which can result in loss of a significant portion of the central vision. So again, if a patient with wet AMD were to stare directly at the center of this baby's face, they could still see the baby's lips, they could still see the baby's hand here, but they might have trouble making out details about the nose and the eyes and the forehead because there would be loss of that central vision. So I wanted to bring your attention to one other point. A lot of patients ask me, well, doctor, why do they call it wet AMD? So let me see if I can get my pen going here. So why the terms wet, I'll put these in quotation marks, or dry macular degeneration, which also goes by AMD. And people say, well, doctor, when my eyes are watering, does that mean I have wet AMD? Or, you know, my eyes feel very dry, so does that mean I have dry AMD? And I think this is very confusing terminology for patients that we use the terms wet and dry. The reality is when we say people have dry eyes or they have tearing, that really has to do with the front surface of the eye. There are tear glands that exist or are found under the eyelids. And when those tear glands overproduce tears, that causes tearing, or when the surface of the eye, which is the front here, becomes dried out, that can cause itching and burning and scratchiness, and we refer to that as dry eyes. Now, when you're talking about AMD, or macular degeneration, as you might remember, that refers deep within the eye to this retinal layer, and in fact, to this specific area called the macula. So the presence of blood or fluid in the macula causes us to characterize that patient as wet macular degeneration. Or if there isn't any blood or fluid in the macula, we call that dry macular degeneration. And so probably a more accurate term is macular degeneration with blood or blood vessel growth, or macular degeneration without blood or blood vessel growth, rather than causing it wet or dry. Well, now that we've talked about wet macular degeneration and shown you how it affects patients' vision, shown you what causes wet macular degeneration. In my next video, I'd like to try and teach you about the treatments for wet macular degeneration. So see you in the next video.